encourage early detection and diagnosis. Recommend referral if symptoms are observed. Our position as community health workers is important, as we're usually the first ones our patients turn to when they're not feeling well in our communities. When they share symptoms that could be serious or indicate cancer, it's our responsibility to ensure they visit the health facility urgently. By acting quickly, we give them the best chance of early diagnosis and successful treatment. Sometimes, patients may complain about general symptoms such as unexplained weight loss, fever, and tiredness. Others may mention pain, changes in their stool, digestion or skin, growing lumps, or wounds that won't heal. These may seem general and can be signs of other health conditions. However, they may also be the first and only symptoms of cancer. Patients may also share specific worrying symptoms, such as coughing up blood, that can be linked to certain types of cancer. Let's explore some of these specific symptoms so that you know what to look for. Symptoms that may be related to colon cancer include bright red or black blood in the stool, pale skin, unexplained weight loss, feeling weak or tired, sudden changes in bowel movements. Symptoms that may be related to liver cancer include feeling very full after a small meal, nausea or vomiting, stomach pain or pain near the upper right part of the back, a swollen stomach, yellow skin and eyes. Symptoms that may be related to prostate cancer include urination problems, such as taking too long to urinate or being unable to control urination, blood in the urine or semen, struggling to get an erection. Symptoms that may be related to breast cancer include a lump in the breast or underarm, fluid from the nipple, a change in breast size or shape, thickening, wrinkling, or pulling in of the skin or nipple, swelling, warmth, redness, or darkening of the breasts, an itchy, dry, and flaky sore or rash on the nipple, feeling pain in the breast. Symptoms that may be related to cervical cancer include an abnormal pap test, bleeding if it is not a period, vaginal discharge that is different from normal, pain during sex or in the lower part of the stomach or back. Symptoms that may be related to lung cancer include a lump on a chest X-ray, struggling to breathe, losing weight, a cough that does not go away or gets worse, coughing up blood or reddish-brown mucus or phlegm, chest pain, a rough or strained voice. We may be the first to notice that something might be wrong, so we should ensure that patients go to a health facility immediately if they have any cancer-related symptoms. We should also educate our patients on the symptoms to look for. Our watchful eyes can help catch cancer early, giving our patients a better chance of recovery.